All right, welcome back. This second course on tantrums is where we go deeper. Not just what they look like, but what is happening inside the body and what actually helps.
We're going to talk about different feelings like frustration, fear, and that full body overload feeling, because they don't all need the same response.
Then we'll cover bedtime tantrums, because that's when everyone's tired and patience is low. It's when even small things can feel big and over-emotional.
After that, we'll get into sensory overload, which can look a lot like a tantrum, but is actually the nervous system saying, this is too much. Then we'll talk parenting styles, not in a judgy way, more like what response helps the brain calm and what can accidentally make things worse.
And finally, we will finish with the important bit, when to worry and when not to, so you can feel confident and not anxious.
And as you watch, keep this in mind. Your job is not to stop feelings. Your job is to guide the nervous system back to calm.
All right, let us start with what feelings look like in the body, because once you can spot the early signs, everything gets easier.
Every big feeling your toddler has starts from a calm place. But calm doesn't last long when you're still learning how emotions work. And emotions all a predictable pattern. Frustration usually shows up first, if that tiny face before things explode. At the beginning, inside their little bodies, frustration starts like a spark. Small at first, but it grows fast. When something doesn't work the way they want, this spark becomes a flame. That's frustration turning into anger. This is because their brain doesn't have a slow mode yet. Big feelings hit hard and overwhelm them in seconds. Throwing, screaming, stomping, that's not bad behavior. That's a tiny human drowning in a big feeling. They need your calm more than your correction when the emotions are this strong. Anger feels huge for toddlers. Their nervous system goes into full storm mode. Your job isn't to stop the feeling. It's to stay close while it moves through them, guiding it out the door. And fear works differently. It shows up when something feels too big, or too dark, or too sudden. Small things, like a nightlight, a cuddle, or just your presence, can shrink fears instantly. Because inside their imagination, shadows become creatures until you show them the world is safe. Anything such as loud sounds, strangers, dogs, sudden movements. Fear can pop up anytime. And sometimes their feelings get mixed together. Embarrassment, frustration, fear, it all blends into a mini emotional storm. So when that emotional wave hits, kids don't have the tools to ride it yet. That's where you come in. Even tiny challenges feel massive when you're only 2 feet tall and still learning cause and effect. So when you sit beside them and breathe slowly, their brain begins to copy your calm, which makes anger soften quickly when their nervous system feels safe again. Safety always comes before logic. Don't forget, fear needs reassurance also. Toddlers look for you to judge if something is scary or safe. That's why one brave step from you becomes one brave step from them. And when they take tiny brave steps, their brain lights up with new confidence. Another thing we can do is naming the feeling helps. This organizes the brain. You're angry, you're scared, you're frustrated. Simple but powerful. Every time you help them understand the feeling, you're building emotional intelligence. And the best news? Big feelings become smaller feelings with practice, patience, and your calm support.
Thanks for watching. If this helped you, don't forget to like, subscribe, and follow along for more simple pediatric tips every week. See you in the next video. Because bedtime isn't just sleep. It's transition, separation, and a tired brain that can't cope with one more demand. So if your evenings feel like a battle, you're not imagining it. It's the story of every household, I'm afraid. It's because the nervous system has hit its limits. It cannot take anymore and is bringing out these big emotions. And the goal isn't to win. It's to make the routine predictable enough that the brain stops panicking. So let's put on our pajamas and let's talk bedtime tantrums and how we'll make nights calmer for everyone.
So now you can see how frustration and fear build up. The next place these big feelings show up, like clockwork, is bedtime.
Nighttime tantrums usually start with one thing: a very tired child who absolutely refuses to admit they're tired. The moment you say bedtime, their whole body goes into defense mode and sleep is the enemy. They'll run, hide, negotiate, distract, and perform acrobatics just to avoid pajamas. That's from manic flaw onto the floor. Classic overtired behavior. Their brain is done, but they haven't accepted it yet. Because when their emotional battery gets red, every tiny thing feels like a crisis. Yawning while refusing help is basically the toddler version of, I'm not tired, you're tired. So what can we do? Do a heads-up warning. A 5-minute warning softens the transition from play to sleep. And toothbrushing battles are normal, believe me. Toddlers hate anything that interrupts their agenda. What I do is let them choose one bedtime toy, creates cooperation without chaos. Too many choices invite trouble. Bedtime works best when the whole evening gradually shifts from high energy to calm. And story time is golden. Even if they wriggle the whole time, their brain is slowly winding down. Bedtime stalling is practically an Olympic sport. Water, questions, another teddy. Predict creative, trust me. When these excuses pile up, that's a sign their brain is trying to delay separation, not being gonnied. But a calm tuck-in and gentle tone helps signal that the day is ending. Predictability is your friend. Another point is, nighttime feelers often show up right as they're falling asleep. Shadows are bigger, sounds seem louder. But leaving the door slightly open or keeping soft light nearby helps them feel connected, not alone. Because their imagination is powerful. Even friendly shadows can feel scary when you're small and tired. But by holding them close resets their nervous system. Rocking, cuddles, or just a worn hand help a lot. And putting them back in bed while staying nearby teaches them they're safe without needing to leave the room. Remember, touch is powerful. A slow back rug tells their body it's okay to let go and return to sleep. And when their emotional storm clears, you'll see their shoulders drop and breathing slow. That's regulation returning. Even a little light can be the difference between panic and peace. It's a tiny anchor in the dark. So once they finally fall asleep, the whole room feels calmer. That peace is earned by both of you. And mornings after cuff lights remind you of the truth. These phases pass. Your patience helps them grow.
Thanks for watching. If this helped you, don't forget to like, subscribe, and follow along for more simple pediatric tips every week. See you in the next video.
Now, bedtime gives you a great example of something important. Not every meltdown is emotional. Some are sensory overload meltdowns. Sometimes the brain isn't upset, it's overloaded. Too loud, too bright, too busy, and the system just shuts down. This is why supermarkets or restaurants can feel impossible. Lights, crowds, sounds, choices. It's like asking a tiny brain to do 10 jobs at once. So the response changes. Less talking, less correcting, more reducing the input, and creating calm fast.
Let's go into sensory overload properly so you can spot it and respond in a way that actually works.
Some meltdowns come from emotions, and some come from sensory overload. They may look similar, but they're very different on the inside. Sensory overload happens when something suddenly feels too loud, too bright, or too much. Because for some toddlers, sounds aren't just sounds. They feel like waves crashing over their whole body. Even footsteps or a sibling's energy can overwhelm a sensitive nervous system. Supermarkets give another example. Full of sensory triggers, lights, crowds, noise, colors, it's a lot. But your toddler isn't being difficult. Their brain is simply getting too much information at once. Them covering their ears is not a tantrum. It's a signal that the world feels too loud. And visual overload is real too. Too many bright colors or patterns can be overwhelming for the little ones. So when sensory overload continues, the meltdown isn't emotional, it's physiological. What helps is moving to a quieter space as soon as you can to help their nervous system breathe. You will note that as sensory input decreases, their brain slowly returns to balance. You'll feel a shift in their face. Even playgrounds can be sensory minefields. Noise, motion, children everywhere. It can be too much fast. From their point of view, everything might feel like it's happening at once. It's overwhelming, not misbehavior. And when the overload peaks, crying or shutting down is the body's way of saying, I need a break. These swirling, big feelings aren't anger. They're sensory signals gone into overload mode. Finding shade or a quiet spot helps their nervous system recover much faster and alleviate the overload. When you move them to calm, the whole world softens around them. Their breathing slows, their face relaxes. This is their brain recalibrated. It just needs less noise, less light, less everything. Even a calm corner at home works wonders. Soft textures, dim lights, predictable space, fairy lights, pillows, soft toys, sensory objects. These help the body settle after overload. Weighted toys or blankets give deep pressure, which calms the nervous system beautifully. And when their sensory world balances, their emotional world balances too. Everything reconnects. Your calm presence in that space tells them you're safe, your mind rest. And when they finally reset, you'll see it, the peaceful return to play. It's a sign their nervous system's down calm again.
Thanks for watching. If this helped you, don't forget to like, subscribe, and follow along for more simple pediatric tips every week. See you in the next video.
Now here's the part that connects everything. Your response and your choices are the fastest way to change what happens next.
Because your little pediatric patient is learning regulation from you, not from your words, but from your nervous system. So this isn't about being perfect. It's about knowing what helps and having a plan for when you feel triggered too. And when you do lose it, repair matters. That one step, apologizing and reconnecting, is incredibly powerful.
All right, let's talk parenting style in a real-world way. What helps the brain and what accidentally fuels the storm?
When faced with a frustrating situation such as a tantrum, how we respond to it shapes how our children learn to handle big feelings. No pressure, I promise. When their tower falls or they don't get to watch the TV and they get upset, your calm reaction teaches them how to handle frustration. Connection acts like emotional glue. It's very important as it holds everything together when their feelings fall apart. And by staying close, getting low, and staying calm, you show them, your big feelings are safe with me. But let's be honest, sometimes we react with frustration too. We're only human, and we all have our own personal backgrounds. Even still, when we shout out of frustration or stress, children don't learn calm. They learn fear or confusion instead. The good news? Empathy works instantly. For example, by naming the feeling, you'll immediately help their brain organize the chaos. But when we yell, their emotional alarm gets louder. Their brain hears danger, not guidance, which leads to more chaos. So by showing them calming techniques like slow breathing, you teach them to reduce the chaos and learn a tool they'll use for life. Inside their brain, your calm literally lights up the pathways that help them move from a place of chaos to a place of calm. If all they hear is yelling from their grown-ups, the tantrum usually gets bigger, not because they're defiant, but because they're overwhelmed. It's as if their thinking brain goes offline when the environment feels unsafe. They can't process logic in that moment. On the other hand, when you comfort them, their whole nervous system softens, impulses slow down in their mind. That's connection doing its job. But on the days we do yell, and yes, we all have those days, yet you apologize after. You teach the most important skill of all, repair. And why is repair important? Repair builds trust. It tells your child, even when things go wrong, we can make it right again. So where is the sweet spot between these extremes? Clear boundaries with warmth. Children feel safe when they know the rules, but still have room to test them, because your child will still push back. Testing boundaries is part of healthy development. You don't want them to feel caged either. Calm, consistent boundaries help tantrums become shorter and, over time, less intense. Too few boundaries can actually make children feel overwhelmed. They end up leading without knowing how. Think of a blind sea captain. When everything feels messy or unpredictable, tantrums grow because the environment isn't holding them. Offering two choices gives structure, but still lets them feel powerful. Would you like to eat the apples or the bananas? Every moment of calm parenting strengthens their emotional circuits. You're wiring their brain for resilience for the long run. And if you do lose your patience, it's okay. Reconnecting with a cuddle or a book teaches them they're loved, even in hard moments. Perfect parenting isn't the goal. Connected parenting is. Children learn best through love, boundaries, and repair.
Thanks for watching. If this helped you, don't forget to like, subscribe, and follow along for more simple pediatric tips every week. See you in the next video.
So now you've got the tools: calm, boundaries, connection, and repair. The next question is how you know what's normal and what needs a closer look. Because most tantrums are completely normal, even the dramatic ones. But there are a few patterns where I'd want you to check in. And I'm not saying that to scare you. I'm saying it so you feel informed and know when to trust the phase and when to trust your gut. So let's finish with a clear checklist-style conversation. Normal signs and the signs that deserve a chat with your GP. All right, here's when to worry, and just as importantly, when not to.
Let's start with the good news. Most tantrums are completely normal. Annoying? Absolutely. Concerning? Usually not. Things like the wrong snack, the wrong toy, or socks that feel all wrong? That's classic toddler drama. Normal tantrums can look intense, but your toddler still loses, cries, reacts, and eventually looks for comfort. If they melt down and you say no, that's not a red flag. That's just being two. Overtired tantrums can look huge too, but once the need is met, think so. Again, very normal. In all these moments, the emotional brain is switched on, but everything is still working in a healthy way. Even when they completely lose it, you'll usually notice they still respond to your voice or your presence eventually. Now, let's gently talk about what's not so typical so we have both sides of the story. If your toddler suddenly freezes or stares blankly during or after a tantrum, that's something to pay attention to. Repeated headbanging or hurting themselves more than you'd expect is worth mentioning to your GP. If they can't calm even a little with your presence, comfort, or chime, that's a sign we should look a bit deeper. Extreme meltdowns with no response to anything at all can sometimes point to overload, pain, or something neurological. If they go unusually quiet or unresponsive after a tantrum, that's important to mention to a doctor. Breath-holding spells, especially if they turn blue or faint, should always be checked. Anything that looks like a seizure or makes you think this isn't a normal tantrum deserves urgent care. Seeing a doctor doesn't mean something is wrong. It means you're being proactive and protective. Your GP will listen, examine, and guide you. You're never wasting anyone's time by asking. Often, a quick check and a bit of reassurance are all you need to feel confident again. Aggressive behavior that's intense, frequent, or doesn't respond to boundaries is also worth a conversation. Repetitive behaviors alongside meltdowns, like lining toys or extreme distress with change, are worth reviewing too. None of this means something is definitely wrong. It just means we explore it together. And don't underestimate your instincts. You know your child better than anyone. If something feels off, even if you can't explain why, that alone is a good enough reason to check in. Most tantrums are normal. Some need a cause to work. You are the best judge, and help is always available.
Thanks for watching. If this helped you, don't forget to like, subscribe, and follow along for more simple pediatric tips every week. See you in the next video.
All right, deep breath. If you've watched all of this, you now understand tantrums with a lot more clarity. Feelings, sleep, sensory overload, and your response.
Most of the time, this is development, a growing brain learning regulation. And the best support is you and only you. If something feels truly off, like blank staring, unresponsiveness, repeated self-injury, or anything that worries you, it's always worth checking in.
However, if what you're seeing fits the normal patterns, trust this. The tantrum phase passes because you're there for them.